MUA Scan Kit. Redefine intraoral scanning of full arch case. Enter the new era of intraoral scanning for full arch case. Precision. No distortion. Opposite scanning. Different Geneva L height. Precise position. Standard kit-sterilisable box. The whole box can be autoclaved and sterilized, and the codessa remarked for storage. There are 12 skin bodies, including 8 of 3 mm and 4 of 7 mm. There are 15 connect pins in total, 3 length 10, 15 and 20 mm, 5 of each size. 8 protective caps will be placed here. 8 opposite skin bodies can be used for passive seating, temporary bridges. Free spray when scanning. 1 screwdriver. Simple packing box. A non-kit-sterilisable box. Components are all the same as standard box, except the protective caps. Different identity points, large all-round identification. The connect pins with different groove design and different length. Solve the intraoral scanning distortion problem. SLA surface treatment plus tin-coated or anodizing. Anti-corrosion, wear resistant, anti-reflective when scanning. Universal connect pin interface could match with skin bodies to apply to various cases. Screws with integrated design could prevent dropping and enhance the safety. 1 skin kit could apply to 10 different implant brands. 1 for 10. Save cost and improve efficiency. Apply to full arch cases, half arch cases, multi-unit tooth loss cases. No more challenge of intraoral scanning for full arch case.